All right, today we're diving into a really fascinating medication, one that performs this incredibly delicate balancing act right inside the human brain. It's a powerful tool for sure, one that can restore control, but like any powerful tool, it absolutely demands respect.
So let's just start with a question. What happens when the system that controls your body's every movement starts to go wrong? I mean, imagine losing control over your own body. Not in some big dramatic way, but in these small, persistent, and just maddening ways. What does that actually feel like?
Well, it might look like uncontrollable tremors, the kind that make even simple tasks feel impossible. Or it could feel like these painful, sustained muscle spasms that just lock up your neck or your jaw. It could also be this relentless internal restlessness, an inability to ever sit still. Or it could be a creeping stiffness that makes every single movement feel like you're trying to walk through wet concrete.
But here's the thing. What if all of these really profound physical problems actually boiled down to a surprisingly simple chemical imbalance? The solution we're going to talk about today is a drug that's designed to do exactly that, to perform a delicate balancing act.
Okay, so to really get the solution, we first have to understand the problem, right? And that problem, it starts deep inside the brain, in the part that's basically our movement control center.
So deep in a part of the brain called the basal ganglia. Think of it as mission control for movement. You have two key chemicals that are always talking to each other. On one side, you have dopamine. It's absolutely crucial for starting smooth, controlled movements. And on the other side, you've got acetylcholine, which plays a huge role in how your muscles actually function. For everything to work right, these two have to be in perfect harmony.
The best way to think about this is like a chemical seesaw. Yeah, a seesaw. When both sides are perfectly balanced, movement is smooth, it's normal, it's exactly what you expect. But the moment that seesaw gets tipped one way or the other, that's when the problem starts.
So what happens when one side of that seesaw suddenly gets lighter? Well, in Parkinson's disease, the brain cells that make dopamine start to die off. So with less dopamine, that side of the seesaw goes way up, which means the other side, the acetylcholine side, is now way down. There's a relative excess of its influence. And that imbalance is what directly causes those classic symptoms like tremor and stiffness.
But Parkinson's isn't the only thing that can cause this. Some antipsychotic drugs, they work by blocking dopamine receptors. Now, this is great for treating psychiatric symptoms, but it can create the exact same imbalance in the brain's movement center. It's basically a drug-induced version of what happens in Parkinson's. The seesaw gets tipped all over again.
So if the whole problem is a tipped seesaw, how do you fix it? Well, you've got two options, right? You could try to add more weight to the light side, or you could take some weight off the heavy side to even things out. The drug we're talking about today, Benztropine, it takes that second approach. And that brings us to Benztropine, which you might know by its brand name Cogentin. This is what's known as an anticholinergic medication. And honestly, the name itself gives you a massive clue. Anticholinergic. It's designed specifically to work against acetylcholine.
So here's the genius of it. Benztropine doesn't try to add more dopamine. Instead, it goes over to the heavy side of the seesaw, the acetylcholine side, and it sits on its receptors, effectively blocking them. By doing that, it reduces acetylcholine's influence, letting that tipped seesaw come right back to a level position. And just like that, the symptoms of tremor and stiffness start to get better.
All right, so that's the theory, right? It's basically a chemical rebalancer. But where do doctors actually use this stuff? Well, it turns out it has two very specific and very critical applications.
First up, it's used as a helper therapy in Parkinson's disease. It's not the main treatment, but it is really good at targeting those specific symptoms of rigidity and tremor. And its second use, which is maybe even more common, is to treat the movement side effects caused by those antipsychotic drugs we were just talking about.
Now, this whole group of side effects has a technical name, extrapyramidal symptoms, or just EPS for short. And Benztropine is one of the go-to frontline treatments for them. We're talking about things like acute dystonia, those sudden, really painful muscle spasms, drug-induced Parkinsonism, which looks a lot like the real thing with tremor and rigidity, and akathisia, which is just this awful internal feeling that you have to constantly be moving.
So, up to this point, benztropine sounds like a pretty perfect solution, doesn't it? But here's the catch. Acetylcholine isn't just working in the brain's movement center. It's working all over your body. So when you block it, you're not just leveling that one seesaw in the brain, you're basically flipping switches off everywhere else. And that, of course, comes with a price.
These side effects are a direct result of how the drug works. Think about it. Acetylcholine helps manage tons of automatic things your body does. So when you block it, you're reducing saliva, which gives you dry mouth. It affects the tiny muscles in your eyes, causing blurred vision. It slows down your digestive system, leading to constipation. And on the more serious side, acetylcholine is also involved in thinking and memory. So blocking it can cause confusion, memory issues, and even hallucinations, especially in older folks.
And this actually leads to the most severe warning the FDA can issue. It's called a black box warning. It's the strongest one they have. And it says that benztropine should not be used in elderly patients who have dementia-related psychosis because it leads to a significantly higher risk of death. I mean, that really underscores just how carefully this drug has to be handled.
And there are other key precautions too. Elderly patients in general are just extremely sensitive to those cognitive side effects. Plus, because it messes with your ability to sweat, there's a real risk of heat stroke in hot weather. And you can't just stop taking it cold turkey. It has to be tapered off slowly, otherwise the symptoms you are treating can come roaring back.
So this brings us to the final balancing act. And this time, it's not just about dopamine and acetylcholine inside the brain. This balancing act is about weighing the very clear benefits of this drug against its very real risks.
And that's exactly why the #1 rule for doctors who prescribed benztropine is a simple little phrase that's easy to remember. Start low and go slow. You always begin with the lowest possible dose, and then you increase it very, very gradually. You're trying to find that perfect sweet spot where you get the most benefit with the fewest side effects.
So really, this is the core dilemma, isn't it? On one side of the scale, you have this incredible benefit, restored movement, relief from absolutely debilitating tremors and stiffness. But on the other side, you have the risk, a whole host of side effects, the potential for cognitive problems, and some really serious health dangers if it's not used just right.
Ultimately, benztropine is a powerful drug that really highlights a central theme in all of medicine. Using it requires a very careful risk versus benefit analysis from the doctor, it requires vigilant monitoring of the patient, and it demands thorough education so that the person taking it understands exactly what trade-offs they're making.
And that really leaves us with one final big question, one that goes way beyond just this one drug. When you're dealing with any powerful medical treatment that comes with significant risks, how do we, as patients, as doctors, as a society, decide when its power is actually worth its price?